Welcome, everybody, to another edition of Beat Your Addiction with John Giordano. I'm your co-host, Scott Jones. Thanks for joining us here today. And before we get started, while we have just a moment here, and John and I chit-chat, why don't you take this moment to subscribe to the channel. Certainly hit the reminders so that you know when other shows are coming up. And more importantly, share this with your friends. Take a moment and share this with people so that we can get the message out. This is all about helping people with addictions, mental health, people who are out there who are suffering, and people who are struggling with recovery. This is all about them. John, how are you, my friend?
I'm doing phenomenal.
Phenomenal.
I met these young ladies that have this ketamine clinic that we're going to talk about now. And I never really believed in ketamine in the beginning.
Right.
But we're going to talk about, I'm going to explain about how my wife, who suffers from depression and anxiety and been medication for 43 years, how it has turned her life completely around. I'm still in shock. I think it's the most incredible technology that's coming down the pike.
Well, you know, this is one of those moments that we can kind of point to the fact that things are always changing.
Right.
And you have to be looking for alternatives or different things all the time. The answers that worked 50 years ago don't work today. Or there are more effective things today. So we're always looking so that something that you may not have considered 5 years ago, you might want to look at today. I mean, you're always searching.
I'm always searching. I'm always looking at the literature. I'm always looking at researching. I'm always looking at seeing different people that go through different things. I want to know what works because my son almost died from this. My wife almost died. I almost died from this disease. And there's so many people dying out there. We really got to get better treatment options and things and I know it's scary for a lot of people. And I know like ketamine was a club drug, Special K and all this, but it's completely different when you do it under different circumstances and different dosages and you do it under a medical supervision.
That's the big one right there. Medical supervision. Almost every illicitly used drug out there has a purpose if it's medically used. Well, but that's not what people are using it for.
It's kind of comical to me is because when you think about these SSRIs, Prozac, Wellbutrin, or all these, so many suicides because of SSRIs, people don't even look at that. These medicines are really toxic. Now, look, certain people maybe need to be on medication. I'm not against anything. I'm for what works. If it works for you, fine. But I don't know. Everybody I know that takes these SRIs, they got to change the dosage, add another one, take away another one. And these things were not meant for long-term use. They were meant for short-term intervention.
And we see a lot of that. So anyway, so we have a really special guest. You started by saying you met some nice young lady.
They're terrific. And they care. They run a great program.
I'm just going to tell you, John, if you started a sentence with, I met some nice young ladies 30 years ago, this would be a different conversation.
Different conversation. That's true.
John's a much different human being. Anyway, yeah, I had a chance to speak with Sonia before the show started. I'm excited to bring her in. So let's do that. And we're bringing in, sorry about that in and out there. We're welcoming Sonia Cotto to the show, who is the owner of the Ketamine and Infusion Clinic of South Florida. Did I get that right?
You sure did. Thank you. Okay. Thank you for having me.
Oh, it is absolutely our pleasure. It's nice to have somebody in our own backyard that we're talking to. Usually we got somebody up in Wisconsin or somewhere else.
Canada.
We've had them all California.
Wow.
So we got somebody in our own backyard we're talking to. And this is interesting because, again, we're always finding new things. And the answers that we had 10 years ago, they're different than they are today. And what we're going to know 10 years from now is probably going to be different again. But these are some interesting things. I'm looking forward to you and John talking about it. I'm just going to get out of the way and let you guys go at it.
All right, go for it, Sonia. Tell us what you do, how you do it.
Yes, definitely. Well, just touching on the antidepressants that you were just talking about, like how people are just still struggling, on multiple different medications. Where ketamine comes into play is, with antidepressants, you're treating an outcome and you're almost providing a Band-Aid from so much history of where it began. You're not treating the cause, you're just taking care of the symptom. And that's what that medicine is. With, mental illness, my family struggled with it their whole life. And me being an anesthesia provider, I use ketamine every day. And when I found out the mental health benefits of it at such a low dose. I mean, I use anesthetic doses, in the hospital every day, but doing low doses, how it can help transform and really get to the root cause of the mental illness and really allow that transformation. I couldn't not get involved. Ketamine traditionally is an anesthetic, and that's what it's FDA approved on. But there's been thousands and thousands of studies, and first ketamine clinics started opening in 2000. South Florida is kind of late to catch up. So I think the first clinics were around 2017, 2018 here. But in low doses, it actually allows not only the chemical benefits to help treat, you're taking these SSRIs, MAOIs, all these SNRIs to treat this imbalance, neurotransmitter imbalance. However, there was so much stuff beforehand, and ketamine in low doses does treat that, but it also does something more. It allows a psychedelic experience to allow you to really get to the root cause of when the depression started. When I consult my patients, I'm always, when they're telling me, oh, I've suffered from depression for 20 years, 10 years, 15 years. My first question after that is, what happened 10 years ago? What started changing in your life? And it's not even just, it didn't have to be a traumatic event. It could have been simply moving, right? Losing your best friend, breakup, all this stuff. There's so many different things that happen in your life that causes stressors and stories and different things that really go into your subconscious. And ketamine in the psychedelic space, really, that's the future really of mental health. And I'm able to be at the forefront with something that's legal, and I can provide it in a safe, controlled manner to treat everyone, and it actually has a role in addiction as well, which is why I'm here with you talking, John.
Well, let me tell you, I knowing firsthand what you do, I found him through a friend of mine who was doing a documentary actually on Lamar Odom and his daughter. And they did the ketamine treatment on, I think I did it on Lamar, and you did it on his daughter, or just his daughter. I don't remember which one.
Just his daughter. Just his daughter.
Just his daughter. And they had phenomenal results. And it perked my interest because I was in Taipei doing a lecture at a neuroscience conference, and they were talking about ketamine, some of the scientists, and how addictive it is, and how this and how that. And I said, no, I don't want anything to do with this, because I was going to open up a clinic, But then I found out, this is like 5 years ago, that over time things changed, and they did some research on it, that it wasn't the way it was presented. As you know, things change. We learn more information, and we see different stats.
Like opiates aren't addictive, right?
Right. I mean, it's at these doses and done in the clinical setting and they do follow-up care, which is paramount. Okay. It's not that you do ketamine and you're fine. They have coaching, they have follow-up care, and they also help you titrate off medications in a safe way. And now, how do I know this stuff is good? Well, first of all, my wife did it, 6 sessions. She's a different person, like I said earlier to you. I mean, I just can't believe how much she changed. So I wanted to do it, and I did it for myself, for my own issues. And it's been an incredible journey. It's not getting high. It's not wanting to, zone out. You're zoning in. And the zoning in is not so pleasant as when you're really looking at your stuff. But you get resolution. And they're just, not all ketamine clinics are the same. That I can tell you now, because I did my research on them. And this one, they're on top of you like white on rice. And they follow through, and they really care.
That's a technical term right there. White on rice. I have to ask a question really quick. I'm sorry, because you brought up so much at the beginning, Sonia, and it's great.
Yeah, sorry, I can't keep just ranting.
No, it's fine. It's fine. But you mentioned that it's clinically accepted or FDA accepted for use with as an anesthetic. Are there current studies being done so that it can be registered and used for this on an official level?
Oh yes, there's thousands. I mean, I'm almost on a daily, I have like stacks here of new articles, research articles being studied and printed every day, published for that. That's how we developed our protocol.
Okay.
That's the hope, because right now insurance doesn't cover it. Right. They
Right.
do
But if it
cover for
does get
some pain
accepted,
infusions.
if it does get
Right.
accepted, then insurance could step in.
Well, what's
Exactly.
really good about what they do is they not only could finance it for you, and it's not that expensive, and they also take credit cards, and listen, they really care, and their pricing is much better than most people.
And the other piece I had to ask was, is this combined with a therapeutic modality of any other kind? Obviously, it's not just, is there you know what I mean? Some sort of trauma therapy or anything that goes along with this as well? Do you combine
Yes, I
these
mean,
things?
that is it's so important. We always encourage our patients to have, if they have a psychotherapist on board with their private. We actually also brought on a ketamine integration coach, because we did find a lot of patients were not utilizing that tool. And that is so paramount. I mean, I tell them when they come in you can't just come in for a ketamine infusion and leave and go back to your life, go back to the same diet, the same stressors, the same everything, and expect a different result. You have to put in the work. You need to see a therapist. You need to have psychotherapy or EMDR, or go, and meet with our integration coach, because that is the key to really have that transformation. And the real healing, because during this during this infusion experience, there's a lot of research that says it's really just the chemical benefit. And, we can geek out on that later, but really what I found is the mystical experience. And that's like the real magic and real healing tool of psychedelics and the future of mental health, is getting into that root cause, having that transformational experience, but then being able to work through it. They talk about all this stuff with psychedelics about having that bad trip, and everybody's worried about it. There's no such thing as a bad trip. There's such thing as not being prepared and not having the right support and not having the proper integration, because those things are in your subconscious mind. When you have a bad trip, or a bad experience with any psychedelic, that is being brought up to you from your subconscious. It's being released and revealed. And how do you process that? How does anybody process that? If you don't have the right support and the right integration, that medicine can then turn and make your mental health worse. It is so important to have that support. You have to have integration. You have to have journaling. You have to have coaching, psychotherapy, all of that, to really get to the root cause.
John,
Right?
this is really
Otherwise,
good
it's
to
just
hear.
temporary.
This is good to hear, because it's not saying it's just like a miracle thing. You do this and
No.
everything's better.
No.
This becomes part of the puzzle of all the different things you have to do, which is really your expertise in all those different areas.
That's exactly right. And that's what we did at my treatment center. That's why we became so successful, because we looked at addiction and mental health as a mosaic. It's not just a standalone.
Yeah.
Everything is everything is integrated into our body. This is a whole comprehensive approach. You need the proper diet, because if your gut's out of whack, your neurotransmitters are going to be out of whack. Because as we know, 60 to 90% of serotonin and dopamine is manufactured in your gut. If you don't take care of your food, your diet, you get inflammation, you get stressors and things like that. You cause disease. And people don't realize it, that our food supply today and our water supply is really, really not so good. So you have to really stay on top of yourself. Look, what good is living longer if you don't have a quality of life? What this substance does, it gives you one leg up on what you need to do, and it helps you to look into what I call the hard drive of the brain, which is the subconscious, and go to the root cause of what's actually causing your abnormality. And that, to me, is paramount. Instead of putting a Band-Aid on it and just see what these medications do, all they do is they dampen your emotions. And when they dampen your emotions, you're not learning anything. You're numb. And then people have all other kinds of problems. They have weight gain. They have, they also suffer from depression, because then they have to change medications. They're numb to their reality around them. These are toxins that we're putting in our body. We need to get a whole program, and that's what they do. They show you have to journal. They have coaching. They have nutrient IVs. They can put you on a diet program, or not a diet, a life-changing program. Okay, diets don't work. You have to do a life program. And that's what I've done. And I do my best to set an example. I don't do everything perfect, because if you're perfect, you'll be praying to me. So, I'm not God. I'm just a human being that has all the other frailties of other human beings. But, I'm going to be 76 on Saturday. I work out. I'm in great shape. I don't take any medications. I don't do anything. And I'm open-minded. Most people are scared and closed-minded. Don't be. No risk, no gain. And what this does is, the reason why I like it is because the benefit outweighs the risk. And risk is minimal when it's done in a proper setting.
Ms. Sonia, if people are watching this and they're thinking, like, who's a candidate for something like this, and what would somebody, in layman's terms, if we could, why would somebody look into this for themselves or someone that they care about?
Definitely. With patients, and the reason why it's like close to my heart is there's so many people that have tried multiple medications, and you try one and you start and you have bad side effects. You try another and you try another. And it's just, the struggle is real, and there's really no new developing medications for it. Those are the people that it's ideal for: depression, anxiety, PTSD, even fibromyalgia, migraines. Those are also really, beneficial. Ketamine is beneficial for them. Some patients that we are not able to treat with it would be schizophrenia, just because it can actually cause hallucinations. It can trigger, just because of the chemical imbalance that causes the auditory or visual hallucinations can be stimulated during ketamine infusions, as well as manic bipolars can trigger a mania if they aren't controlled on mood stabilizers, because some of those actually will increase to kind of trigger the manic response in those patients. So we have to follow. It's not an absolute contraindication, but we do have to follow that closely to see if they do get into a manic phase, and then we have to stop treatment.
And disassociated people that have disassociation.
That as well.
Right, that as well.
Yes.
But you see, here's the deal. They're not just about money, okay? Not that money's not important. They look at you as a human being, and they don't just take you in, okay, just to take you in, because they make sure that you're appropriate for this. Because this is a healing place. This is not about so much business like corporations do. They just want in and out, make the money. What's the bottom line? If that was the case, I wouldn't even be involved with them.
Right.
You know how I am. So the bottom line is, this has got to be a healing place. And, if just like my place that I started with $300, as you know, and when we sold for $45 million in 2012, we couldn't believe it, but we never chased the money. We were always into the healing, always helping people, always doing God's work. You will attract all the good stuff by doing the good stuff. And I firmly believe that. And that's why I got involved with Sonia and her clinic.
I think that's brilliant. And I wanted to ask about if we can somehow bring this around to addiction for a moment. How is this appropriate in addiction treatment? And at what point in the addiction? Is this after a short-term recovery you would look into this? Or is this, during a transition? Or how would this fit in?
There are definitely different patients and different programs. And so when somebody reaches out to us, we do definitely have to tailor it at different stages. Obviously, if somebody's going into an acute detox, they're pretty strict as far as, obviously you can't leave the detox center when you're in an acute detox setting. When you're in the early recovery period, that's something that is very beneficial as well, because with addiction, as with other mental illness, there is always that starting point. There's always that change in your brain, the chronic stressors, the lack of coping or support in your life, from childhood, young adult. Whenever your addiction started, there was a breaking point, and that was like almost a coping mechanism, but also then it affected your dopamine receptors. Right. So you're always on that search for the dopamine because it's been completely depleted with the chronic stress and all that. So it's almost like that artificial, like, oh, let me just get that dopamine to feel better. So in that being said, we have the patients that are tapering themselves off with medical supervision. And at that very last stage is the most difficult, right? When you completely are off, one ketamine infusion, even at the lowest dose, at our starting dose, can subside withdrawal symptoms for up to 48 hours. So let's say you're tapering off, and you're almost completely off. The medication will kind of time it to where you have your infusion either that next day, right after your last dose, or whenever, or maybe even that day, whatever the patient needs. And we just kind of adjust it to those patients. But it's definitely good for the tapering, obviously not the detox. It could help with the detox, but it's too complicated because they are in acute care setting, and that's something that needs to be done separate in their facility, but in the following stages.
That's what I like about them. They know where they begin and know where they end.
Yeah.
Okay. Instead of, oh yeah, we could do it all. Okay. No, when you get people say I can do it all, then I run away from them, because nobody does all of anything.
Right.
Right.
Absolutely. That's really cool. Now,
Well,
John, people are afraid to try new things.
Here's the problem. Okay. It goes like this. I always suggest to people, look, how's what you're doing working? Number one. Okay. Number two, how well do you want to be? Where are you in your life? Are you happy with your life? Are you happy with the way you look? Are you happy with the way you feel? Are you happy with your relationships? Where are you in life? We're blessed to have life. Every moment in time that you're alive is a blessing. And some people, I used to think it was a curse when I was using, of course, because I was in that darkness. And when you're in that darkness, living is horrific. All right. But when you start to come out of that darkness and you get help and you get recovery and you start looking at what went on with you, I sit and do group, and I remember one of the clients, I always tell the story, said, "Oh, you don't understand my family. Oh, if you had my family, you would really understand." I said, "Let me tell you something. I'll loan your mind for a while. My father was a heroin dealer. My uncle's a hitman. Okay, we come from a mafia family. I used to get hit with a belt when I was a kid. You want my family? I'll loan you mine. Okay, give me a break already. Get out of your history and get into the present and start building a new future." And that's what this
and that is ketamine does, because
right.
when you are able to, all of mental health, that was so amazing, John. All of mental health is you're stuck in the past, right? You are dealing and coping with everything that you've experienced. And everybody's families are not perfect. Your parents messed you up, their parents messed them up. It's all a cycle of them doing the best that they knew how to do, right? So stuff happens and you carry it along with your life, and it's hard, and you're moving on, and you're trying to move on, but you're still carrying this big ass backpack of crap. And it's hard to even go from day to day. What ketamine and psychotherapy and integration and all of the alternative therapies and the psychedelics are doing is really allowing you to just let go of that baggage. Like, just release it. Imagine not having to drag it with you every day of your life, and just cope every day, just to get through every day, just hating life. Imagine that's all gone, right? Now you're at this space with ketamine infusion therapy or other psychedelics. Now what? Right? And this is the key moment where you're here in this box of just pure clarity. That's where integration, journaling, and coaching comes along. What do you look forward to tomorrow? You've been barely surviving, dragging on yesterday. Now you have to envision tomorrow. What's your plan? What's your goal? If you could be your ideal self, if you could have your ideal life, you have to imagine it, because nothing ever existed without somebody thinking of it first.
Well, I'm glad you said that, because see, what most people don't understand, there are no failures in life. There are only lessons. It's how you utilize those lessons to create the life that you desire. And what most people do, they don't realize, they go, well, how is this going to work? Everything else failed. Look, if you don't work, it doesn't work. When people say, well, NA, AA, self-help groups don't work, therapy doesn't work, ketamine doesn't work. No. All of these work. You have to work at it. It's not you sit back and people fix you. What we do is we create an environment for you to fix and help yourself. And ketamine opens up that door, okay, clears out that history so you can look at it from a different perspective and then get the help you need so desperately. And there's a lot of desperate people out there.
There certainly are. There's a phone number on the screen. I want everybody to take this down. It's 954-320-4944. And if you go to Extension 1, it's where the new clients or new people go. If they want to call and just ask questions or get some information, that's fine with you, right, Sonia?
Oh, definitely. Definitely. Yeah.
Okay.
Megan, she is amazing. She's our patient liaison, and she can answer any questions. If you have any more medical, then we jump on the line and can answer any more intensive medical questions that you might have. But we definitely have a great team here.
And they got a psychiatrist on staff, and they have nurse practitioners on staff. This is done by medical professionals that really have a good handle on alternative medicine as well. So it's not just the psychiatrist is also an integrative psychiatrist. He's not just a regular psychiatry who looks at alternative medicine. So you have a really complete show over there. And that's what attracted me. You don't just have a ketamine clinic.
Yeah, it's not just a stop and a shot.
Right.
You build something, because even if you get people on an even keel, you got to give them direction. And from everything you're talking about, you put a lot of focus into that as well about now what. And so that way they go out the door with purpose instead of just going out the door without goal. Right.
And developing an alumni, developing like I did with my place, I'm going to help them do that, is where they're part of our family for as long as we're alive and they're alive. And that's what makes cohesion.
That is excellent. That is excellent. Now, I have to bring this up. We've got a few minutes left, but I have to bring this up. Ketamine has been known to be abused. Like most other drugs that have any kind of effect on the brain, even some of them that don't do anything, people still abuse them just because that's what we do. You have the way you have your distribution, the way you have your what you do. It protects people against being able to abuse the drug. Is that correct?
Correct. Yes. We don't. We do not prescribe for at-home use. Where it can be abused. That's where it can be abused. But I do want to point out the fact that obviously, just like you said, anything can be abused. Ketamine is less addictive than coffee, caffeine, sugar, carbohydrates. I could easily have somebody come off of ketamine faster than they could come off of French fries, because it is not physically addictive.
Really?
No.
Yes. Yeah. Very minimal. So it's really just, when you have access to it, if you have addictive personality, you're going to get access to whatever you can. And, I think ketamine is more readily abused in California. In California, it's really big. But that's why we drug test, right? If you come in and you are already on ketamine, we're not going to give you ketamine directly through the IV, obviously, we do want to manage that, and we do support them, through their endeavor for that. But it's important that they aren't actively abusing when they're in this program, so that we can get them off all the medications.
Well, one of the reasons I bring that up, and John, you know this as well as I, probably better than I do, that there's a lot of people that might be coming through the door that don't quite have faith in themselves and have the strength in themselves, that if they're given something, they're afraid they're going to abuse it themselves. So this takes that out of, see, they're coming to get some of us. So who's in trouble?
Right.
It wasn't me.
Right.
But some people are afraid that they don't trust themselves. So the fact that you guys don't even make that a question, you're not going to come in here and abuse this, that helps people too, doesn't it, John?
Oh, absolutely. Look, some of these clinics, I don't, just like the Ibogaine situation. Ibogaine is also a psychedelic that they help people get off opiates and alcohol and stuff. But you get some of these people, they're do-wellers, they're do-gooders, they really want to help people. What happens is, they give them Ibogaine, they throw them in a hotel room, or they don't even check their blood, they don't check anything, what medications they're on, how is their heart functioning, what's going on. And if you don't do it in a proper way, anything, I don't care, any kind of medication, anything that you do, can be detrimental. So it's got to be done properly. The only problem I have with the ketamine clinics is that they give this take-home stuff. That's dangerous, because it's like taking home heroin. I mean, what are you doing? The bottom line is that this is not something you really want to do all the time or get high off of. Right. It's not that kind of an addictive drug, okay? especially when you're going into your traumas and you're going into all your other stuff. It's not a pleasant place to go without guidance and without help, to get benefit. So it's very important when it's done properly, under the proper guidance. And, if you want to go run out and get a ketamine, I'm sure you run out and get heroin or anything else too.
Right.
And they probably want to go out and get the heroin more so than the ketamine. So
most likely.
that was a club drug years ago, and everything, as you said, everything changes.
Yeah. Sonia, I mean, it's great to have you here, and what you're doing there sounds wonderful. Before we wrap up, I want to give you a moment or two to, if there's somebody out there thinking they're kind of on the fence, they're not sure, they have questions, what can they do, and what do you want to tell them about, why this is so important to you?
Yes, this has been a game changer for mental health. It has transformed everyone's lives, and then John's wife, Michelle, firsthand that was our most recent transformation. So it's been a beautiful experience. But if you're scared or nervous, give us a call. You're always welcome to come into the clinic. You'll see it's not a clinic setting. You're going to come in and feel like you're in a spa. It's as non-clinical as clinical as it could be.
It's a home setting.
It's a home. Exactly. It's a home setting. You're in a comfortable recliner with blankets. And yes, you're going to be monitored, but you don't feel it during the infusion experience. You're just in your own space, but at the same time safe. So, for those that are scared, we're there with you. And, myself as an anesthesia provider, we give a lot higher doses. So this is a low dose. It's very safe and it's very therapeutic and it's life-changing for you. You can only take these antidepressants for so long or keep struggling through rehab and still finding yourself in the same situation at the end. Why don't you have a different experience? You don't keep doing the same thing and hoping for a different result, right? You want to try something different. And sometimes it's getting uncomfortable, right? Going to that uncomfortable space. As our doses go higher and as our patients are getting more into their transformational experience and really having that life-changing infusion, it's always about being curious and just, why is your mind showing this to you? Why are you experiencing this? And always wonder, because it's there, whether you see it or not, whether you experience or not in an infusion, it's there subconsciously and you're subconsciously feeling it, so why not be aware and get that power?
And they help you create an intention. Intention is primary before you go into that ketamine experience. So they put eye shades on you. They got a headset on you with music and it's noise canceling. So you're in a containment field and you're inside. You're not getting outside stimulation. It's an inside job. So you're looking at you.
Yeah. It's really like a meeting of your subconscious with your conscious.
Yeah. I mean, obviously, I can tell you this. I can tell you that rarely do you find somebody who's like they've got issues, whether it's anxiety or depression or any kind of mental health that runs along those lines, where they say, well, here's something that might work for you, and it works for them. That's a rarity. Actually, what happens up happening is they bounce you between 20 different medications. They're constantly adjusting your doses. If you're tired of that, this might be the answer that you've been looking for. I mean, we're not telling you that what you're doing is working and you're perfectly happy. You don't have to change what you're doing. But there's so many people that it's not working. Why are you settling for that?
But one of the things that I want people to know, you don't have to get off all your medications. Only certain medications counteract with the ketamine, and they let you know which medications do that. So if you're afraid to get off your medications, don't be, because you don't have to get off your medications. Only certain ones temporarily while you're doing the ketamine.
And it's worth a try.
Sometimes we can just have you hold it. Like if you're not, some medications that will interact, if you just hold it that day for your infusion. We do require a referral from your psychiatrist or whoever's providing your mental health or addiction treatment. We do require a referral because it is a team approach. We are providing the service, the ketamine infusion therapy, the integration coaching, pretty much the life coaching as well. And really the journaling, teaching and all that. But it's a team approach with your provider, because in the end, you may come off of some of your medications, right? But it's important that everyone knows it and works together to do it as a team.
See, that's what I'm saying. They do a really good program.
If you want to know how to get the referral, you can always call them and talk to them about it. They'll explain it. Some people might not know what they need to do. You'll walk them through the process, talk to them. Again, 954-320-4944, extension 1. And if you're just curious, listen, that phone call might be a 5-minute phone call with just some, obviously from what I'm seeing, some wonderful people. You might spend 5 minutes talking to a wonderful person, and no harm, no foul. But you might find out that this is something that you've desperately needed, and take advantage of that, right, John?
Knowledge is power. If you do not inquire, you will not learn.
We've also had on the screen for a period of time is the Ketamine Clinic KetamineClinicSouthFlorida.com. Please check out the website as well. And Sonia, you must be proud of what you do. That's all I could say.
Oh, I love it. I get to just see
Yes,
transformation and help people every day. We also actually have a YouTube channel now that Megan has been producing. You know, there's some answers on how to find a therapist, how the process starting your infusion, what integration coaching is about. We even have our integration coach there. And then some of our playlists are listed there as well.
Oh,
for our
excellent.
music.
You guys TikTok stars too?
We haven't advanced. We're not, I look young, but I'm not that young. So we might work on that in the
Don't worry
future.
about it.
But yeah, for YouTube channel, it's just Ketamine Clinic South Florida, and it has a lot of resources there that we've been sharing.
Excellent. John, you brought another winner with us today. I'll tell you that.
Absolutely.
Tell you that.
Oh,
Sonia, thank you again so much for your time, and thank you for what you're doing. It takes innovators and people to look at things in a different way and bring them forward, and that's how we learn and that's how we grow. So we appreciate that. Hopefully everybody out there will give Ketamine Clinic in South Florida an opportunity to answer their questions. You don't have to go in and do a service, but you definitely find out, because if it is the right thing for you, you could change your life.
Absolutely.
You can change your life.
Yeah.
Sonia, thank you very much for joining us.
Thank you so much for having me. I loved it.
All right, we're going to put you in the back room for a minute while we close out the show. Just hold on for us, though, okay?
Okay, perfect.
All right. John, she's great.
Yes. They're wonderful people, too.
Wonderful people, and you've got personal experience with them. And again, I think sometimes it's just it's breaking out of the norm and trying something new.
I don't ask anybody to do anything I don't do myself for my own family.
But there's still a hesitation of trying new things, especially when you hear the word ketamine.
That's right.
We got to change our thinking.
That's normal, okay? But when you get more information, you get a better understanding, and especially when you meet these ladies there, you'll get a nice warm feeling and realize that they're professional, they know what they're doing, they make you feel comfortable and in your uncomfortability.
It's amazing what we learn. It'll be amazing to see what in 10 years from now we're going to figure out.
Absolutely.
Can't
wait.
But you can't move forward by sitting on your hands and just doing the old
No
stuff.
Decision,
you got to go forward.
No decision is a decision. And
That's
don't
right.
forget that. Okay.
That's right. John, I want to thank you so much for your time, as always, and the message that you like to put out there for everybody. And I want to remind everybody that if you want more information about John and his mission and all the things he's been doing, you go to johnjgiordano.com. His books are available there, multiple books.
And the research. I'm in 79, now 80 medical and scientific peer-reviewed journals. So we do research, evidence-based modalities. We don't just do, anecdotal stuff.
Yes, absolutely. Look that stuff up. Reach out to John. More importantly, take advantage of the information you get. Do your due diligence, do the research, and then follow through. Don't just discount things. What was the old thing about contempt?
Contempt prior to investigation.
Yeah.
Well, I always tell people this: please don't believe a word I tell you. Go look it up for yourself.
That's right.
Do your own due diligence. Don't just go by me. Go by you, and see where it takes you.
With that, we're going to close things out. Again, please remember to share this with your friends, and definitely subscribe to the channel. And until next week, your co-host Scott Jones, along with John Giordano, saying you all take care now.